If you're dealing with severe breakouts and stubborn blackheads, the instinct is to attack them aggressively. But that approach often backfires, leading to more irritation. Today, we're taking a different path. I'm going to walk you through my SOS, severe routine, a strategic method for inflamed, congested skin. The goal isn't just removal, it's to lower inflammation, safely clear what we can, and protect your skin barrier to prevent future breakouts. Here's the SOS severe map. We'll soften and sanitize, do an oil break double cleanse, use spot logic, swell down inflammation, extract green lights, use a vitamin A rhythm, envelope the skin, and cover repeatable habits. A quick reality check. This routine is powerful for home care. But if you have widespread, painful cysts or rapid scarring, please see a board-certified dermatologist. Severe acne often requires professional support to prevent long-term damage. S. Soften and sanitize. First, soften the sebum plugs with a warm towel or gentle facial steamer on congested areas for 2 to 3 minutes. The key word is warm, not hot. It should feel comfortable, not scalding. This makes hardened sebum more pliable and easier to remove without force. Next, hygiene is non-negotiable. Wash your hands thoroughly, then sanitize both your hands and any tools with 70% isopropyl alcohol. This prevents introducing new bacteria. For an extra layer of protection, you can mist your face with a hypochlorous acid spray and let it air dry. O. Oil break double cleanse. Now, the 60-60 method. First, massage a cleansing oil onto dry skin for a full 60 seconds, focusing on congested areas like the nose and chin. This dissolves sebum and grime. Then, wet your hands, emulsify the oil into a milky liquid, and rinse thoroughly. Immediately follow with a water-based cleanse for another 60 seconds. A gel cleanser with salicylic acid is great if your skin can tolerate it. If your skin is red or raw, choose a gentler formula with soothing ingredients like heartleaf or cica. Your skin should feel smooth and slippy, not tight or squeaky, which indicates a stripped barrier. S. Spot logic. This is our traffic light system. Green means go. These are raised blackheads and fully surfaced whiteheads. For these, you can use short contact therapy. Lather a 2.5% benzoyl peroxide wash. Apply only to congested areas for 60-90 seconds, then rinse. If you're sensitive, a 3 to 10% sulfur mask for 5 to 10 minutes is a great alternative. Yellow means proceed with caution. This is for closed comedones, those flesh-colored bumps. Don't force them. Instead, press a BHA toner onto the area for a few seconds, 2 to 4 times a week at night, to slowly dissolve the plug. Red means stop. Do not pop deep, hard, painful cysts or nodules. Attempting to extract these will cause inflammation and scarring. For these, your only tools are ice and a hydrocolloid patch. S. Swelling down. Before extractions, calm the inflammation. Hold an ice cube wrapped in a soft cloth on any inflamed bumps for 60 to 90 seconds. This reduces redness, swelling, and pain. Next, flood the skin with calming hydration. Gently press a soothing toner with centella, heartleaf, or panthenol into your skin. No rubbing. As an optional step for oily skin, apply a tiny amount of zinc PCA serum to your T-zone to regulate sebum. E. Extract only. Green lights. Now, we extract only our green light spots. Ensure your tool is sanitized or your fingers are wrapped in tissue. For blackheads, use the lift and roll technique. Stretch the skin taut, place the loop past the blackhead, apply low pressure, and gently roll the tool back over the pore. The plug should glide out. For whiteheads, use the Q-tip cross-compress method. Place 2 cotton swabs at a 45-degree angle on either side of the blemish. Gently press inward and then slightly upward to encourage the contents out of the opening. The most important rule is the rule of twos. If the plug doesn't release after 2 gentle attempts, stop. It's not ready. Forcing it causes trauma and hyperpigmentation. And again, never attempt to extract deep cysts, milia, or ingrown hairs. Leave those to a professional. After a successful extraction, follow this micro-protocol. Sweep the area with sterile saline, pat dry, apply a tiny dab of salicylic acid spot treatment, and cover with a hydrocolloid patch overnight to protect and absorb fluid. V. Vitamin A. Rhythm retinoids are gold standard for preventing clogs. On non-extraction nights, apply a pea-sized amount of a retinoid like adapalene gel over your entire face. Start 2 to 3 times per week. If your skin is sensitive, Use the sandwich method. Apply a thin layer of gel moisturizer, then the retinoid, then more moisturizer. This buffers irritation. Never use retinoids on the same night as other strong actives like AHA, BHA, or benzoyl peroxide. Envelope skin. After actives, envelop the skin. First, press in another layer of your soothing essence. Second, apply a thin layer of a 4 to 5% niacinamide serum to regulate oil and strengthen the barrier. Finally, seal everything with a lightweight gel moisturizer containing ceramides and hyaluronic acid to reinforce your skin barrier. Your morning non-negotiable is sunscreen. Every single day, use a non-comedogenic formula with at least SPF 30. UV exposure worsens acne and deepens post-inflammatory dark marks. Repeatables that prevent reclogging. To maintain clear skin, incorporate these habits. Once or twice a week, use an enzyme mini cleanse to gently digest dead skin cells. Lifestyle hygiene is also crucial. Change your pillowcase every few days, wipe your phone screen daily, and cleanse your face within 15 minutes after a workout. Wash makeup brushes weekly, and if you feel the urge to pick, put a hydrocolloid patch on the spot instead. So what can you expect? Within 48 hours, you should notice less pain and pressure. After 7 to 10 days, your T-zone should feel smoother. By the 4-week mark, with consistent use of your actives, you should see a visible drop in the blackhead cycle. A few quick questions. Can I extract daily? No. Limit this full routine to once every 2 to 4 weeks. What if I'm sensitive to benzoyl peroxide? Use the sulfur mask alternative. What about a retinoid purge? Some initial breakouts can be normal for 4-6 weeks. But if you experience severe irritation or painful cysts, stop and consult your dermatologist. This routine is about long-term strategy. It takes patience. If you found this helpful, save it and consider subscribing. Be gentle with your skin and always seek professional care when needed.